Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us again for our press conference update on Delaware's response to COVID-19. We appreciate you joining us again. We have some important information to share today as we experience a December, holiday surge in COVID-19 cases across our state. We're privileged today to have as part of our team leaders of two of our major hospitals in our state, Sharon Kurfuerst, who's the Chief Operating Officer of Christiana Care. We appreciate Sharon's expertise and the knowledge that she brings to us today with respect to the situation at the Christiana Care in the emergency room and in the hospital more generally. And we also have Dr. David Tam, who's the new, I guess not new anymore, the CEO, President and CEO of BB Hospital in the lower part of our state. We appreciate both of them being part of our conversation today. It's important to note that we have, at one point during COVID response, we had weekly conversations with our hospital partners. They've been doing an amazing job treating patients, testing Delawareans, vaccinating Delawareans, and now dealing with this seasonal surge, if you will, in COVID-19 cases, mostly Delta cases. You hear a lot about Omicron. We won't talk a lot about that today, but I wanted everybody, I've invited the hospitals to join us to a press conference today because I want every Delawarean to know what our nurses, our first line healthcare providers are experiencing on a daily basis. I want them to understand the surge that we're experiencing and the stress that puts on our hospital resources. It's something that, as governor, I've looked at and focused on since the beginning, and we'll explain a little bit of how the situation that we are encountering now in December, just before the Christmas vacation and the new year, the surge we saw last year. We'll take you back to those numbers in a minute, the effect that that's having on our caregivers and the stress that that's putting on our hospitals. And we'll walk through some of those slides simply because there are more people in the hospitals this year at the time of the year than there were last year. And because we, as a society, are more active, people are on the road, they're getting in accidents, they're getting the flu, all kinds of other conditions that take them into the hospital, and you'll see in a minute how that is affecting our just tremendous caregivers that we have in each of these hospitals across our state. So we thank Sharon and we thank Dr. Tam for joining us. We thank them and all the nurses and workers there, frontline hospital workers, for their tremendous work over the past 21 months. So let's go right to the data. We'll give you a data update to start. We're up to almost 800 new cases on a 7-day moving average. Realize that those cases vary based on the testing that's done on a particular day. And so we use a 7-day moving average. That is 7 times where we want it to be. We had our goal back in the summer when we'll show that graph was to be under 100, and we got way down below 100, and now we're closing in on 1,000. It's not where we want to be. The positive tests, we're up to almost 11%. Again, the World Health Organization target is to be below 5%. Some of that, again, and the reason we use the 7-day moving average is because the amount of testing does fluctuate on the day of the week and other conditions. And so it does tend to go up and down. But here's the number again that I've focused on over the last 21 months, and that is the number of people that are hospitalized, because Sharon and Dr. Tam and the people that work with and for them count those patients every day. We know how critical they are. We know what age they are. We know a lot about them, and we know that they're sick enough to be in the hospital. And we only have so much hospital capacity, which is so that's a number it's very real. It's not dependent on tests. It's not, I guess it may be somewhat dependent on whether somebody takes themselves to the hospital or calls 911. but it's as real a number as we have. And we continue to lose lives. We're closing in on 2,300 to 2,249, everyone. A precious life, somebody's grandmother, somebody's coworker, somebody's mother or father, and a precious life, everyone. So let's look at the hospitalization roller coaster ride, going back to the start of the pandemic in March, April of last year. And you can see we got much healthier, not as many people in the hospital during that first summer, starting around Memorial Day, as I remember, getting better all the way through the summer. And then again, we got the post-Thanksgiving holiday surge with the peak of hospitalizations there at 474 in January 14th of 2021. But remember, the hospitals at the time had cleaned out their census. They were very careful about managing who was in the hospital, no elective surgeries as I recall. And so they had plenty of space and frankly, didn't want to have numbers like that, but they were able to handle it and handle it very well. Then we got healthier. The surge stopped, and as we went into the spring, things dropped in a more of a manageable level. Another little bump up, and then we got really healthy during last summer. We hit a low of 14, only 14 people in hospitals on June the 26th. Had our fall surge as people went back to work. Remember, now we're getting people vaccinated. We did meet President Biden's goal of having 70% of adult Delawareans vaccinated by July the 4th, and we'll show those vaccination numbers where we are today. But we still have way too many people who are not vaccinated. And there's a lot of, maybe it's 30% overall, but that leaves a lot of individuals for that virus to pass one person to another to create the situation that we are now with 390 people in our hospitals. And we're in a much more difficult situation that Sharon and Dr. Tam will talk about. We're at 390 than we were back at 474. And that's the reason for having our friends at the press conference today. So here's a graph, and Sharon will talk about a little bit more in a minute, that shows as we're approaching 1,800 people in the hospital, and you can see that there are COVID-related patients and non-COVID related patients, and the majority are non-COVID related. But we know that the COVID cases are preventable if people get vaccinated, and Sharon will explain how that's affecting Christiana Care, and Dr. Tam, the lower part of our state. So I mentioned that so many of those hospitalizations are preventable. We have about 30% of Delawareans that are not fully vaccinated. The COVID hospitalizations that we just showed you, 71% are unvaccinated or partially vaccinated individuals in our state. So if you think about a solution, if you think about there's one thing that all of us can do to help with the hospitals, to help with the caregivers, to help our nurses and frontline hospital workers, it's get vaccinated if you're not. Get fully vaccinated if you only have one shot, and get your booster if you have two. So let's look at the vaccine data. We've already administered, a great team of people at the pharmacies, the hospitals, the primary care physicians, our state health clinics, the big clinics that the state ran last spring, 1.5 million vaccines administered, almost 64% of Delawareans who are fully vaccinated. That's about 620,000 Delawareans. But if you think about it, it's very uneven in certain demographic groups. And we'll talk about those subgroups in a minute, but 93% or better of Delawareans 65 and older, so my age and older, we know what we need to do. We know we're vulnerable, and we're getting vaccinated, fully vaccinated. In that case, the number is almost 99% for at least one dose, and some considerable number of elderly Delawareans have a booster as well. 18 and over, we're closing in on fully vaccinated, 75%. And then total Delawareans, okay, some of the younger little ones are not quite eligible, just recently became eligible, not eligible for their second dose at 67%. So let's look at those rates by group, and you can see that the group that's really lagging behind and where there's a lot of room for the virus to move from one person to another is in that young adult group, 18 to 34, where statewide you only have 40% that are fully vaccinated and 40% in Kent County, 45% there in Sussex, and a little higher rate in Newcastle County. But more than half or more percent of those of the Delawareans in that demographic, 18 to 34, are not vaccinated. Of course, the 5 to 11 group, those numbers are low. They're getting better, by the way. They're low because most of those are not eligible for their second dose yet. And so you can almost double those numbers if you consider just one those with one dose. So boosters, we're doing better on boosters, but still a lot of folks, particularly in 65 and older, that need to get their booster shot for greater protection, particularly when we're seeing this surge. You want to have the most protection that you could possibly get, and getting that booster will do it. So those of us who are more vulnerable, 65 and older, need to get that booster shot, and those younger as well. You can get the vaccine at the Delaware Public Health vaccination sites at our public health clinics. Here's a list of those clinics. You can find that on our de.gov/coronavirus website. We're also providing tests at some of a few of the states: Oxford, University Plaza, Canby Park, Georgetown, and the Blue Hen Corporate Center. If you have any questions, there's the number up there, and it's on the website as well, 833-643-1715, and go to option 3. You would be advised to get an appointment for these public health clinics. You can still get vaccinated. Most of the vaccines are being delivered right now by our pharmacies. It is advisable now to get an appointment. Call your pharmacy up and get an appointment. They have reduced their hours. They're also having challenges with some of their staffing, but most of the vaccines are being provided now across the state through our pharmacies. It's important to get tested, particularly if you're moving around, visiting relatives and friends, your children coming home from school. You can get an at-home test through Vault Health. It's a free test, and you can request the kit at de.gov/home test. Does take a couple days or a minimum of 24 hours once from the time you put your test into the UPS box. So just be mindful of that. That is a test that's directed through somebody that comes to you remotely on your laptop, and a good way to do it. Then you get the answer back in a couple of days. The Pixel test through LabCorp is also free, and you can learn more about it at de.gov/get-tested. This is a new option for folks as well. So fighting the surge, we're going to hear from Sharon and Dr. Tam next. All the Delaware hospitals now have postponed their elective surgeries. That means they're not going to have fewer people in the hospital for that. But by the way, if we could come together and take these protective measures and flatten out this curve and beat this surge, then that's going to mean that people that have delayed elective surgeries will be able to get those surgeries scheduled up a little faster. And we know that that's better for their overall health. So think about your neighbor in that respect so that they can get the health care that they need. So also get vaccinated or get your booster. And one of the things that we really want to enforce or reinforce today is that everybody should be wearing masks when they're indoors in public. I always put my mask on when I'm going into the Wawa to get my coffee every morning. Most of the other people, as I go in there, have their masks on. It's something that they request or require of their customers, and a lot of private businesses, particularly retail businesses, are doing that. Please honor their request to do it. We can all pull together and do a better job by wearing our masks. We can talk about mask mandates, but at the end of the day, it really is individual people complying with this recommendation that you wear a mask to prevent the spread of COVID-19, and in particular, to help our nurses and our healthcare first responders, frontline workers that you're going to hear about in a minute, and the hospital care that's so important to all of us. So fighting the surge, we're in conversations with our hospital partners and long-term care facilities to create an operation that would enable us to move patients that are currently in hospitals but don't necessarily have conditions serious enough to warrant that care, but there's nowhere to release them to. And so standing up an alternative care site, working with training provided to the Delaware Army and Air National Guard to do that, something that we're working hard on. It's something that our hospital partners have asked us to do, and we're putting all our effort in doing that. At least 50 members we hope to be onboarded by mid-January, so it's not an immediate solution. We have to have these folks trained up so that they can provide the support. We're also doing additional contact tracing in schools, using CDC resources to support the contact tracing in schools, meaning when there's a positive case that's mostly coming from somebody from the outside, say an employee in the school or a child who's been exposed at home, making sure we're doing the contact tracing to take care of folks who also may have been exposed. And shifting community contact tracers to support more tracing in schools. One of my highest priorities, you remember going back to the summer and fall, was to get children into schools for in-person learning. I spent a day yesterday in Bancroft School and Warner School here in Wilmington, and in both cases saw how important it is to have children in school for face-to-face in-person instruction with their teachers. All the children had their masks on, the teachers had their masks on, they had good social distancing in the classrooms, and it's something that we really want to keep a focus on. We do have a test to say program ongoing so that students and faculty can get tested and return or stay there at work so they can continue the important work that they're doing. So thank you to our school nurses. This is a shout out to our school nurses for everything that they're doing. We know there's a lot of interaction now, particularly with the contact tracing, with you as parents, with students. Please work with our school nurses and so that we can keep students and school personnel safe and free of COVID-19. If you need to get your COVID-19 vaccine, you can get it at information at de.gov/getmyvaccine. We have public health clinics. You have your local pharmacy where you can do that. Again, that's it for me in the data. I want to now turn the floor over to Sharon Kurfuerst and Dr. David Tam. Sharon, as I said, is the Chief Operating Officer at Christiana Care, doing a tremendous job over the last 21 months in managing and working with the physicians, the nurses, everybody providing care and being the point person for all of that. She's been a great partner for us in the Division of Public Health. And Sharon, we appreciate very much you joining us today.
Governor, thank you so much for the opportunity for Dr. Tam and I both to be able to share what's going on in our hospitals today, and to you and your team for the tremendous partnership over the past 20 plus months as we've come together as Delawareans to really make sure our community gets the access to healthcare services that it needs. You showed the slide earlier, and if we could advance the slide, that would be terrific, of the Delaware hospitalizations over the past several months. And so you can see that the census is pretty significant in the hospitals across the state. Some of that is COVID, But there are a fair amount of folks who delayed care over the course of the past 22 months of the pandemic who are now needing to be hospitalized for legitimate medical reasons. And that compounded by the amount of COVID patients that we are seeing today is really straining our healthcare system and resources, both at Christiana Care, but also throughout the state. Our beds are full. We are running at frequently over 100% capacity, often around 110, 115% capacity in our hospitals. Our emergency departments are incredibly busy. They are very crowded. Patients are waiting longer than usual to receive care because of the volume of patients that are arriving. And as you mentioned, Governor, non-urgent procedures have had to be delayed or postponed because of the hospital census. Again, you can see on this slide, as a state, we are nearing 1,800 patients that are hospitalized. It's an incredibly high number. And that doesn't count patients in the emergency departments. Those are patients in admitted beds. So add to that another couple of hundred patients on any given day in our emergency departments, and you can see the strain on the system and the strain on our resources. Really, we need the community's help during this time. Our operations are seriously strained. Our beds are full, as I mentioned. There are patients receiving care in hallways because that is the only place that we have to put them in the emergency department right now. Our staffing is stretched, and we are juggling supply chain and equipment needs every day in order to ensure that we are providing care to patients. Our ability to continue to provide care is without a doubt threatened as the volumes continue to increase. And certainly there is concern post the holidays, not only for a potential spike in COVID, but we know we're entering flu season and hospitalizations traditionally go up during flu season as well. Add to that, people are still having car accidents, strokes, heart attacks. Folks are still delivering babies, and we want to be here for our community, providing efficient care without delays, without extended wait times. But right now in our hospitals throughout the state, this is a balancing act for us every single day. So definitely our plea for help, to take the burden off the healthcare system and off our healthcare workers. Our healthcare workers have been fighting COVID-19 since day one. Our workforce is experiencing shortages. You're hearing about that nationally. It's no different in the state of Delaware. Our healthcare workers are tired and they're frustrated and they're sad. They see avoidable illness every single day as a result of COVID. Much of it among those that are unvaccinated. And it is morally distressing for them to see folks who are sick who could be well with a simple preventative measure. So from a community standpoint, really asking that each and every Delawarean gets vaccinated. And if you've been fully vaccinated, that you get your booster as soon as you're able to do that. You heard Governor Carney talk about wearing a mask, even if you're vaccinated. And we know what works. We know what works to prevent the spread of COVID. It is hand washing. It is socially distancing. It is masking, and it is vaccination. If you're sick, we want you to get tested for COVID-19. We definitely want you to get your flu vaccination. If you have not gotten your flu vaccine up to this point, encouraging you to do so. And we want you to spread the word. We want you to encourage your neighbors and your loved ones to take these same steps. It is through pulling together that we'll be able to move forward out of this pandemic, reduce hospitalizations, reduce the burden on the healthcare system, and most importantly, ensure that Delawareans are safe and healthy and well. Again, can't say it enough. The booster works. It's really important. Adults 18 and over are eligible. There's a location right here on this slide that can share with you how to access a booster, but we really need help in managing the crisis in our hospitals. I am not typically a person who gets stressed or anxious, but I will tell you the situation is dire. We are juggling every day and need everybody to participate in helping us to reduce the healthcare burden throughout the state right now.
Thank you very much, Sharon. Thank you for sharing and creating the sense of urgency that we have here. I got to tell you, listening to your stories about family members being called in to say goodbye to their loved ones who are stricken by COVID-19 is very, very disturbing. And certainly when you think about your nurses and other frontline healthcare workers who have to see that and experiencing that time and again, it's just hard to imagine. Dr. Tam, thanks for joining us again. Thank you for your leadership at the lower part of our state. We know you're relatively new here to Delaware, but it must seem like 10 or 20 years that you've been here since the whole time you came right in the midst of the COVID-19 surge last year.
Thank you, Governor Carney, and good afternoon to everybody. I am David Tam, President and CEO of BB Healthcare, and let's go to the next slide. You know, I want to reiterate that despite the pandemic, despite the surge, BB is open. Everything is open in terms of clinics, in terms of walk-in clinics, our surgery centers, and our hospitals, because we are the community health system here in Sussex County. We found some innovative ways to make sure that Sussex Countyans receive their care, everything from expanding our walk-in programs so people can get the care they need. We, of course, recruited multiple physicians to open up new places, and we have vaccine and testing centers in 2 large of our community areas to ensure that we have a streamlined appointment for COVID vaccine and testing. And you can go online, go to bbhealthcare.org to get that information and to actually schedule a vaccine or testing or booster. And by the way, there are vaccines available today as well as tomorrow. So please make sure you do that. Next slide. You know, we're extremely busy, as Sharon said, throughout the country. I've had friends in California, Seattle, Chicago, and they're all facing the same situation we are. We are not any different, as Sharon said. And, you know, it's a partial thing because the number of COVID patients continue to rise. I think it's okay for me to say that we've doubled our COVID-19 inpatients since Thanksgiving. And a majority of those patients are unvaccinated, but some are also have been vaccinated just because they have comorbidities, they have other illnesses, they're sick. And other illnesses and urgent cases have not stopped. And that's one of the reasons why I don't necessarily talk about COVID patients versus non-COVID patients, because there's somebody who could have come into the hospital who's had a heart attack or a stroke and determined to be COVID positive. At the end of the day, all these patients are coming into the hospital critically ill, and that's causing that stress that Sharon and the governor mentioned. Next slide, please. So the increase in COVID cases has led to a delay in certain non-emergent elective surgeries. And I want to share that with you because, you know, you keep hearing the term elective surgery, which in my mind, even as a doctor, is all about, well, that's plastic surgery or unnecessary surgery. Please know that this means that if you have emergency surgical needs, you get in, we take care of you. But if you have a surgery that is still necessary for your well-being, we now have to make a determination about whether we do that today, tomorrow, or in a week. That could be someone with really bad hip or knee disease who's hurting and now has to wait to get a hip or knee replacement, or somebody else who may have had to wait for a colonoscopy or some other thing that could impact their healthcare. So please know, this is something we look at every single day to make sure that we provide safe care. And healthcare workers have been doing this for the past 2 years, as Sharon said, and we continue to still take care of patients. I'm going to take a minute, though, and talk a little bit about what that means. You know, I had to decide whether or not to wear my white coat because I'm a doctor, although at the end of the day, I'm pretty much not practicing. But I do wear this when I go round on the ICUs or in the ERs because it's part of my PPE as well as my glasses and my mask. I'll tell you, the other day, I saw a patient in the ICU, older, and his two kids came to me and asked, can we please go in and see Dad because we understand he's going to die. And we had this rule about one visitor per patient, which we usually try and really stick to because we don't want patients coming in and getting sick or infecting others. But these two adult kids hadn't seen their dad. They came from other parts of Delmarva, and they had to get dressed up to go say goodbye to their dad. And that was actually heartbreaking for me as well as the nurses to see. It was what Sharon talked about moral distress. I can tell you that I've also seen in our monoclonal antibody infusion center, which is an outpatient treatment, which is important because if you are positive for COVID and you're in a risk group, you can get this treatment that can potentially reduce your risk for being admitted to the hospital. And I have to tell you that I rounded in one of those centers and I saw a young lady who was had other respiratory issues, who was pregnant. And she was getting a monoclonal antibody infusion. She was not vaccinated, for all kinds of reasons, but we took care of her. But you can see the stress and anxiety in her eyes as she had to now make a decision about what to do to get a vaccine, to get the monoclonal antibodies. It's not just, it was about what she wanted to do to make sure that she and her baby were okay. And then the last story I'll just tell you is, I've been rounding a lot in the emergency room. Our emergency rooms are full. There are waiting rooms that are full, as Sharon talked about, of the Christianic care. And, I will tell you that there are people who just are so sick and tired, patients as well as nurses and doctors. The last thing I'll say as I go to the next slide is that please know we're providing safe care. How do we provide safe care when things are critical? We slow things down. We make clinical decisions on what we should do now, what we should do later, and how to provide that care. What does that mean? It means that there are delays as we make decisions about how to take care of people in certain clinical situations. It's easier when there are open beds up and down in the hospital or across the state. But we are now at a point where we are committed, as all of us in healthcare, to providing safe care. But that does mean that you'll have to wait for things like those non-emergent surgeries, right? It means that you'll have to wait if you're in the emergency room because there are other critically ill patients coming in. I apologize for that, as I do when I round in the ER. But that's your guarantee, if you will, that you're going to get safe, quality care, because that's the decision-making going on in our health system. So we need your help to decrease this upward trend. Please continue to get vaccinated. And by the way, that's not just COVID, but also the flu vaccine. Get your booster, wear your mask. And then the last thing I'll say as I go, I believe, to my next slide, if I have a next slide, I don't know if I do, but again, get your vaccine. And then the last thing I'll say before I turn it back to the governor is this. We in healthcare are totally committed to providing quality healthcare for Delawareans during this crisis. It means that things slow down. However, please know that go get seen by your doctor if you feel sick. Make sure that you take your medicines. If you need emergency care, we are there for you. And the last thing I'll say is please be kind to our healthcare workers. They're here working. They'll be here on Christmas. I'll be here on Christmas. We'll be taking care of you as best as we can. But as Sharon said, we're tired. We need help. And the help you can give us is by taking care of yourselves. And then if you are in a situation where you're having to wait, be kind. I respectfully ask you to be nice, to be kind, be polite, because these guys are here to take care of you and do what it takes to provide safe, quality care for everybody in Delaware. And on that note, I want to thank every one of the heroes working at BB, at Christiana, at Bay Health, at Nanticoke, everywhere at St. Francis, at Nemours, because they have been doing this. You know, the last time I saw something like this was in combat, when people just after years and years, months and months of having to be on the front line are just tired, but they're continuing to do the work. And I just want to say thank you to everybody. And I know Sharon feels the same way, for all the work that you do. We have great respect for you. Thank you. And on behalf of BB Healthcare, please ask the public once again to recognize that by providing safe quality care, things will have to slow down as we move forward, but we will get through this. Governor Carney, back to you, sir.
Thank you very much, Dr. Tam and Sharon. Thank you for sharing your experience. And I'm going to put up, there are things that we all can do to thank our frontline healthcare workers, our nurses, our physicians, emergency care personnel, our hospitals, the people that work with and for Sharon and Dr. Tam. And here's a good list here that from Sharon's deck: get vaccinated and get your booster. So particularly if you're in that under-vaccinated demographic there, the young adults, wear a mask even if you're vaccinated in public places and keep socially distanced. Be careful with your holiday gatherings. If you're coming and bringing folks around to dinner, maybe think about having a smaller crowd this year, a smaller group, and be very careful as people travel in and out of Delaware, as your relatives and all, make sure that they're vaccinated or getting tested so they have some idea. What we're seeing a lot of is a lot of asymptomatic spread. And so that's troublesome because the person who is infected may not know about it because he or she doesn't have a fever, isn't symptomatic. But if you do feel sick, get tested for COVID-19. We have lots of places to get tested, get your flu vaccination. Most important of all, if you're not boosted, get boosted and you're eligible. Most adults are eligible, and encourage your neighbors and loved ones and others that you run into to do the same. I have found as I travel around, particularly if I go into a place and folks are wearing masks, then other people, they have masks in their pockets and they put them on. We should all be wearing masks when we're indoors, and it's going to help us. And one of the observations that our hospitals made last flu season, there wasn't much of one. And that was because lots of folks were masked up and there wasn't as much spread as we would normally see. I know Dr. Tam in particular is very concerned about that, what that might mean for us as we get into the new year, into January, and any surge we get from the flu. So make sure you get your flu vaccine as well. So again, thank you to Dr. Tam and Sharon. Special thanks to their teams at all the hospitals across our state. And I know we have press that have joined us, and we look forward to your questions.
Great, thank you, Governor. If any of the press have questions, feel free to raise your hand and I will call you in to ask your question. Governor, we have our first question will come from Tim Mastro from the Delaware State News. Tim, you have the floor.
You might be muted, Tim.
Hi, sorry about that. You got me now?
Yep.
All right. Good afternoon, everyone. Happy holidays. Quick question about boosters. I know we're encouraging them a lot. If you can just go over who is eligible at this point for a booster, if you happen to know the percentage of Delawareans that are eligible, and if you think that's enough to really make a difference in the grand scheme of things in Delaware.
Well, we don't have our public health expert, Dr. Carl Rattay. I'm going to look at Dr. Tam and see if he has that data. While I look through our notes, we did have a slide that talked about boosters. It looks like population 18 and above is eligible. 34 54% have received a booster, 65 and over, 57%. So we're making some progress there, but we'd like to be further along, particularly in the older group, which has been eligible for a longer period of time. Dr. Tam or Sharon, any thoughts there?
So Governor, it's Sharon. Anyone age 18 and above is eligible for a booster as long as it's been 6 months since your second dose of either Pfizer or Moderna to receive those boosters. And Dr. Tam, correct me if I'm wrong, but I believe if you receive Johnson & Johnson, it's 2 months after your dose of Johnson & Johnson to receive a booster.
Yeah, that's correct. And the 18 is also correct. And we know that because one of my kids got it as soon as he turned 18.
Thank you.
Thank you. Our next question comes from Brandon Holvick of the Delaware News Journal.
Thank you. As I'm sure you all know, other cities and governments have considered or implemented mandates of varying degrees over the past couple of days, and Delaware has previously had mask mandates and social distancing requirements. I'm curious if those are all the tools that we know work to minimize the spread of COVID-19 and the situations are as bad as you describe in the hospitals, why don't we have those measures in place now as we did during previous heightened points of the pandemic?
Yeah, I think the objective obviously is to get people to wear masks, to be socially distanced. We currently don't have a state of emergency to that effect. That doesn't mean we couldn't put one in place, obviously, but our objective really is to have voluntary compliance there. We have a lot of businesses that have put in place mandates in their business establishments, and we support that. We're getting the message out to encourage people to wear a mask. When you cut right through it, that probably is the most important thing after getting vaccinated yourself, is to wear a mask when you're indoors and in close quarters with others. Be cognizant of the fact that we have this surge going on and be careful about places that you go. I mentioned demographics, the young adult demographic in particular that has very low vaccination rates. I personally am careful when I'm in an establishment with a lot of folks in that category because chances are 50% of them are going to be unvaccinated. But I think, Brandon, at the end of the day, it comes down to how do you get people to do things that in many cases they don't want to do. And people have tired of that. One of the reasons that we brought Sharon and Dr. Tam on is to just show how important it is to take a simple measure like wearing a mask. I fight every day to keep our mask mandate in place for our schools, to keep our children in schools learning in person and learning safely. And we're challenged to do that obviously more broadly. Some of the areas that you're talking about are places like big cities like New York and Philadelphia, where the density is quite a bit different than us. And obviously, those are things we'll keep looking at as we move through the holidays.
Governor, we have a pre-submitted question from Chris Barish of WHYY. Chris was wondering, at what point, if ever, would you again implement restrictions such as masking, limits, closures of certain businesses that contribute to the community spread that is causing the crisis?
Yeah, so I think I answered that with respect to masking. It still remains something that we can do. We don't have a state of emergency, so we would have to reinstall that. There is obviously mixed feelings about that. On the other side of it, we don't really have the tools with respect to closing businesses. If you remember, we got hundreds of millions of dollars from the federal government to support small businesses. So closing them down could be devastating to them. And so working on protective measures short of closing like that, I think is something that we'll look at first for sure, and monitor the situation. We should be in a way better place because we're limiting with the number and percentage of people that are vaccinated, the exposure that might otherwise be there. Obviously, that remains to be seen as we experience Omicron variant, which is not as present here as it is in other states, I'm told, but some uncertainty that comes at us through that. So fundamentally, it's about trying to get people to follow what we know are mitigation efforts that work, wearing a mask, keeping social distance, particularly when you're indoors. And of course, that's the issue now, right? We're in the cold weather season, people are indoors, we're at the holiday season, people are gathering, but we need people to voluntarily do the things we're asking them to do. And that's why we brought Dr. Tam and Sharon on with us today to underscore how critically important it is for our frontline healthcare workers. We work hard to keep our school mask mandate in effect, our public building mask mandate in effect, and we'll monitor the situation as the days go by.
Governor, it looks like we have no additional questions from the press.
All right, then. So again, we have if you could bring that slide back, the Christiana Care slide with what we're asking folks to do. First, there's a way that you can say thank you to the nurses and first responders and frontline healthcare workers that we've relied on so much over the last 2 years to protect all of us, to provide needed healthcare for those that are sick. And they're pretty simple. Get vaccinated. If you are fully vaccinated, get boosted. Those younger age groups are now eligible. Wear a mask even when you're vaccinated. We do have experienced some of those breakthrough cases. They tend to be milder, and so you may not know that you're COVID positive and spreading it to others because you've been vaccinated. Make sure you keep social distance. Really respect. I think Dr. Tam or Sharon both mentioned it's really a matter of respect for folks around us and our love and care for our family members and friends. If you feel sick, get tested. If you're moving into a different environment where you know you're going to be in close contact with others, get tested. Make sure you get your flu vaccine because we don't want to see a big flu surge as well as a COVID surge after the holidays. And encourage your neighbors and show your family and friends that this is what you're doing, and it'll make it easy for them to do it as well. So thank you all for joining us once again. Have a very happy holidays, Merry Christmas, a Happy New Year, and we look forward to seeing you next year. Be safe, get vaccinated, wear your mask, respect others, and say thank you to our healthcare workers by your actions. Thank you very much.